Hi, you're listening to the Baby Manual podcast, the podcast that helps you feel confident as a new parent. I'm your host, a pediatrician and mom, and the author of the Baby Manual, Dr. Carole Keim. Hello, and welcome to this week's episode of the Baby Manual podcast. This is episode number 15 for when your baby is between 9 and 12 months old. So for the 9-month visit, when I'm talking with parents, it seems that they usually have their routines down by now. I'd say this is sort of a golden period where you're really feeling on top of things. Babies are sleeping a little bit better. You're able to watch their cues a little bit more easily. And usually you feel a lot more confident as a parent at this time. And hey, it's okay if you don't. Parenting is one of the hardest things we ever do. Make sure you engage with your child often by talking to them and waiting for them to respond. A lot of babies at this age will babble back and forth with parents, and they usually start to become mobile at this age, and they'll start to move away from you a little bit, but they should be checking back often to look at you and make sure that they connect and make sure that you're watching them. I like to suggest having a yes space at this age, which is an area where your baby can be totally safe no matter what they get into in that area. So maybe that's a playpen, maybe it's a room, but somewhere where you know that anything that they're touching, if you needed to step away for a second or look away from them, you know that they're going to be safe. You should start having regular date nights at this time, and you can have a babysitter watch your baby. Most parents at 9 months of age are feeling more comfortable letting their baby stay with somebody else. And also make sure you're making time for yourself. You can go and do some self-care things, maybe go get a massage, get your nails done, go get a haircut, hang out with friends, those types of things, and have a babysitter during those times so that you get a little bit of a break. Also, make sure you're having regular date nights with your partner. This is a good time to reconnect and make sure you're on the same page about everything. Somewhere around a year is where the parenting differences really start to show up. So if there's anything you need to talk through with your partner, this is a great time to do that. And with baby, you want to be using consistent and positive discipline, which means things like noticing and commenting on the good behavior that they have, like, oh, you handed me that toy to play with. Oh, you put that away. Things like that. You don't need to say good job. That's actually something, overpraising can actually be harmful to children. So just noticing and commenting on it is one great way for them to get that attention and to know what they're supposed to be doing. And try not to use the word no as much as possible. Instead, tell them what they can do or use distraction. So for example, if your baby reaches for a knife, you can say, oh, here, let me give you a spoon instead, and just swap it out for them. You should also be a role model for your baby at this age. So model for them what to do when you're feeling angry or frustrated or sad, and they'll be watching you and learning those sorts of cues. For development at 9 months of age, a lot of babies will have some stranger anxiety or apprehension, and it starts going away around a year or a little before a year of age. They should be looking for you in a room of people, so they'll seek out their parent and the people that they know well. And they'll be using repetitive consonant and vowel sounds while babbling. So most 9 months old will say mama, dada, but it's not specific. So they might call both parents mama or dada, or they might use other types of similar repetitive sounds like that. They'll typically point out objects. So you can ask them in a book, where's the cat, where's the dog, and they'll point to it. Or they might point at things that they find interesting. They have object permanence at this age. So, at 6 months, when they were grabbing something and you took it away and hid it behind your back, they wouldn't go looking for it. At 9 months, they do start looking for it. So if you take a toy away and you hide it, they'll go after it and they'll go look for where it went. That's object permanence. They'll also play interactive games at this age. So they'll respond to peekaboo when you cover your face and say peekaboo. Whereas at 6 months with peekaboo, they think you're totally gone when you hide your face like that. But now with that object permanence, they think it's hilarious. They also respond well to cause and effect toys. So things like where you push a button and something pops up. They like those types of toys at 9 months. They're going to be exploring their environment a lot at this age. With their body, by crawling or rolling around the floor. With their eyes, by looking all over. And then also with their mouth. So they put everything in their mouth at this age. And that's pretty typical. And they should be moving across the floor on their own to try to get things that they want. If you want to start weaning a pacifier, 9 months is a good age to start with that. A lot of babies, if you wait until after a year, they get a little bit more attached to it and it's a lot harder to do. So If you're thinking you want to get them off the pacifier sooner than later, then 9 months is a good time to start with that. But if they need it, if it's their one comfort object, then I say don't take that away. Let them have something to soothe them down. You can try subbing it out for like a stuffed animal instead of a pacifier at this age. Remember, ones that don't have any eyes or buttons or anything that could come off. They should have the eyes that are sewn on if it's a stuffed animal. For sleep at this age, they're typically sleeping 10 to 12 hours at night and taking 2 naps during the day that are about an hour or 2 each. Babies at 9 months pretty much have their bedtime routines established. So if you have your nice little wind down with some quiet time, maybe some reading and singing to them, brushing teeth, some parents will do a bath before bedtime to help them calm down. But they really get used to those patterns and start to expect them at this age. They should be sleeping in a crib in your room at this age still, but you can consider moving them into a crib in their own room when they're a year of age. Remember, still no blankets in the bed until 1 year of age and no pillows until 2 years of age. And you should not be putting them down with a bottle in their bed. That's a very bad habit that is hard to break and can cause serious tooth decay in babies. If they really need that bottle for bedtime, they're old enough now that they can have water, so it's okay to give them a bottle of water at bedtime at 9 months. For nutrition at this age, they should be doing 3 meals and 2 or 3 snacks per day, typically at the same time as family. So usually they're sitting in a high chair with the family and you're eating all together. Make sure you're offering a variety of foods and textures so that baby can play with the food and get used to a lot of different foods. And you should be offering all of the food groups at this age. The only thing they're not allowed to have is anything containing honey, because honey has a spore that can cause botulism, which can be deadly for babies. And you should not be giving them cups of milk, because milk is fairly lacking in nutrition and it fills them up a lot. But it is okay to do dairy products. So you can be giving them yogurt, cheese, whatever sort of dairy products you have at home. Those are okay, just not straight up milk. They should be drinking still about 24 to 30 ounces of breast milk or formula per day, and then supplementing with foods on top of that. They're getting about half of their nutrition from the breast milk or formula, and then about half from foods at this age. They can start having water on their own in a cup at this age. And I like those little, those solo cups, they make shot glasses and they're 1 ounce and they're the perfect size for babies to hold at this age. They're disposable. If they crush them, it's okay. You have plenty of them. Or if they throw it on the floor, it's not going to break. But you can also use soft like silicone cups or plastic cups at this age as well. And really 1 or 2 ounces at a time is plenty to be offering. And you should offer water with each meal that they have and each snack that they have. They should be eating something green every day. So things like broccoli, string beans, peas, kale, any green veggies. They have iron in them, and that's nice and healthy for them. And also, it's okay for them to have meat. And if you're doing red meat, it should be about 2 or 3 times per week. And having greens every day or red meat 2 or 3 times per week is enough to give them the iron that they need. But if your baby's a picky eater and not wanting those things, then you might need to be supplementing with a vitamin that contains iron. Remember that most gummy vitamins don't have iron in them. And that's because iron is something that babies can overdose on and can be pretty dangerous. So with the gummies being so tasty and looking like candy, they leave the iron out of those gummies typically. So the chewable vitamins are good, or you can do liquid vitamins still at this age. Remember, they're doing lots of oral exploration right now. And if you have a dog at home, most babies will get into the dog food and eat a couple pieces or get into the dog water and play with it. And that's okay. A lot of parents get worried about that, but there aren't really any diseases that dogs carry that babies can catch other than intestinal worms. And most dogs in the US are being treated with some anti-worm medicine. So it's something that, if your baby does end up getting a worm infection, we can talk about that a little later during one of the toddler episodes, but it would look like a very itchy bottom, where when you take the diaper off, they start itching their butt right away, or it might get really red, or you might actually even see worms in their poop. So other than worms, though, it's totally safe for kids to eat dog food. It's not dangerous or poisonous for them. You should also expect them to be eating crumbs off the floor. Anything they find on the floor, they're going to put in their mouth. They're going to put pieces of fuzz in their mouth, dirt, rocks, dust, anything that they can find. They love eating everything at this age. So basically, if they can swallow it, it's okay. It's going to pass through them. Yeah, you don't need to be too worried about them eating things off of the floor. They typically don't get diseases unless it's like maybe in a hospital or in a bathroom or something. That's a little gross. But yeah, for the most part, it's okay to just let them get their hands onto whatever they want. For teeth care at this age, most babies will have some teeth at 9 months, but some still won't. And that's okay. It's okay for them not to have any teeth even as late as 18 months of age. But as soon as they do start having teeth, you should be brushing them twice a day with a toothbrush and plain water or fluoride-free toothpaste. And if you don't have fluoride in your water source, then you can also use fluoride toothpaste, but only the size of a grain of rice on the toothbrush. So just a tiny bit, just enough that you see that you've touched the toothbrush to the toothpaste and a tiny bit stuck to it. And that amount is okay to swallow. So if there's no fluoride in your water source, you can do that to help protect their teeth. And when they swallow that extra fluoride, it goes into their bloodstream and it actually helps the teeth that are still developing inside the gums to get stronger enamel. So it can help prevent future cavities. If they don't have any teeth yet at this age, you can be brushing their gums twice a day with a plain water and a toothbrush, or you can use like a wet washcloth to just clean off their gums and their tongue after they eat, or twice a day. And their first dentist visit is going to be at a year of age. So if you want to plan ahead, you can schedule that now, but after their first birthday. As far as peeing and pooping is going at this age, this is actually a really good age to start potty training. I know in the US, the typical age for potty training is between 2 and 4 years. And a lot of parents look at me like I'm crazy when I say you can train your infant, but you really can. Once they're 9 months, they're able to sit unsupported, which means that if you have a baby potty, you can put them on the potty every time they're done eating and every time they wake up. And just let them sit there for 10, 15 minutes until something comes out. And they get used to that routine, and they will try to hold it until they're able to go on the potty. They won't hold it long enough that they would cause any infections. So babies who are less than a year are not able to hold their pee long enough to cause a urinary tract infection. It'll just come out. But yeah, this is a great time to start potty training. And also it's okay to keep using diapers. They're usually peeing at least 6 times per day at this age and pooping about once or twice per day. And the poops are starting to look more like adult poops because they're eating food. So they should be brown and they should kind of stick together. It's okay if they're a little bit mushy. If they're really hard, like pellets, it means that your baby is going to need some more water and maybe even a little more fiber because that is constipation. Or if they're straining or crying when they poop at this age, then start with increasing their water intake, then increase the fiber, so fruits and vegetables. And then you can consider adding in prune juice or pear juice. 2 ounces once or twice per day should help. And if all of those are not enough, then talk to your doctor before you start any other medicines or any other treatments. Typically, we'll give Miralax for constipation at this age. If your baby develops diarrhea, which is soft, watery poop at this age, then you want to just replace those losses with extra water. Or you can look up a recipe for oral rehydration solution. It's basically water with a little sugar and salt in it. And we do have things like Gatorade and Pedialyte here in the US too that you can use, but also it's a lot cheaper to make it yourself and it actually kind of tastes better. If they don't like the flavor of it, you can put a tiny bit of juice in it or even do half apple juice and half water or 1/4 apple juice with 3/4 water. If babies have too much juice, typically we don't do juice before a year of age. And if they have too much juice, that will cause diarrhea. If you've been giving your baby juice and they're getting diarrhea, then you should cut back on that and just try giving them water or water with a tiny splash of juice in it for flavor. For skincare at this age, they've typically outgrown their baby acne by now, and there's usually not a whole lot going on except the occasional diaper rash. Remember, if a diaper rash lasts longer than 2 or 3 days with regular diaper cream, it's probably infected with something like Candida, which is a yeast, or a bacterial infection like staph. So talk to your doctor if the diaper rash is lasting more than 2 or 3 days and they can send in a prescription cream for you. You should be bathing them as often as they get dirty, which really varies at this age. Sometimes when they're crawling around a lot, they might get dirty every day, and some babies just don't. So 2 or 3 times a week is about the average on this age. But yeah, anything from, twice a week up to every day is okay for this. And you can use lotion in these babies if their skin is dry, but it's typically not necessary. Make sure you're using sunblock if you're going to be outside more than 30 minutes during the day. And a high SPF, like 50 or higher, is great for babies because they don't have a lot of pigment in their skin yet to protect them from the sunlight. And you can use insect repellent, but make sure it's one that's safe for babies. I like the ones that are citronella-based rather than the ones that are DEET-based because DEET is poisonous and it's a pretty harsh chemical. So citronella works really well. And if their skin is sensitive, you can actually just spray the citronella spray on their car seat or their stroller or whatever they're going to be in outside, and that can help protect them from mosquito bites. For safety, We're going to start baby proofing at this age if you haven't already. And so the baby proofing that happens at 9 months is outlet covers so that they can't stick anything into an outlet, stairway gates so they're not falling downstairs. Put some barriers around the space heaters or radiators if you have those, because babies can get burned by touching them. Or if you have like a wood burning stove or a barbecue grill outside, make sure there's a barrier around it so baby can't crawl too close to those. Make sure your cleaning products are locked away, either high up in a cabinet where they can't get to it, or in a low down cabinet that has a cabinet lock on it so that they can't get to that. Remember that babies are kind of like little crooks and they will get into anything if they get enough time to. So nothing is ever completely childproof. If you're able to open it, they can too. It just takes a little bit longer. So putting things where they can't reach it and can't see it is one really good way to just baby-proof stuff. Make sure electrical cords are out of reach. Babies love to pull on stuff at this age. They like to pull themselves up to standing. So they'll pull those cords and can pull things down. And also make sure you're not having any hot liquids or heavy objects on tablecloths or the coffee table at this age, because they are likely to pull those over. And I've seen some pretty bad burns in babies at this age because they pulled over a coffee cup. Make sure you keep your baby in your arms or in a high chair or playpen when they're in the kitchen and also in the bathroom. And make sure they're never in these rooms alone, because babies can drown in a toilet. They can turn on the water in the tub and get burned or drown in that water. And in the kitchen, there are sharp things like knives. There's glass. Make sure the glass bowls and things are up in the high up cabinets where they can't reach them, and expect them to go into the cabinets down below. So I like to keep things like pots and pans down below, or plasticware, like the plastic baby dishes, so that in case they do pull them out to play with them, it's still safe. Also, one piece of advice I like to give is not to take medicines in front of your baby, not even Tylenol, because your baby's going to learn that those types of bottles, you're supposed to open it and put those things in your mouth that come out of it. And they're watching everything you do at this age. So if you do need to take medicines with your baby around, just turn away from them while you open the bottle and put the pills in your mouth. You want to set your water temperature to 120 degrees Fahrenheit. And that is because temperatures higher than that can cause scald burns quicker than baby can pull their hand away. But if it's less than 120 degrees, even if the water's on full hot, they should be able to get their hand out if they touch it before they get burned. Make sure you're avoiding secondhand smoke. And remember, if anybody smells like smoke and is then holding your baby, that baby is breathing in third-hand smoke particles. So if you do need to smoke, make sure you go outside for that. Change your clothes when you come back in and wash your hands with soap and water before you hold your baby. The best is, of course, to stop smoking if you are able to. Make sure that you have a rear-facing car seat until they're 2 years old or until they outgrow the size of the car seat. It's actually safer to keep them rear-facing as long as possible, even, as toddlers, but at least until age 2 or outgrowing the car seat size. And then make sure you save the poison control number in your phone. So if you just go online and look up poison control, you can save that phone number in case of emergencies, in case your baby swallows something, or in case you find them with an open container of something that could potentially be poisonous. They know what to do immediately. And a lot of doctors' offices won't necessarily know all of the poisons by heart, but the poison control centers will know exactly what sort of monitoring they need and whether or not you're going to have to take them into the emergency room. For the 9-month checkup, I love this age. So most 9 months old, as soon as I get in the room, they've already torn up all the exam room paper. And the parents are like, I'm so sorry. And I'm like, it's disposable. It's fine. So expect them to tear up that paper. They might try to eat it as well. I'd say try not to let them eat it. And then also they always try to eat my stethoscope and my badge because they're just, they want to put everything in their mouth. They're just exploring like that. So I always make sure I sanitize my stethoscope and badge before I go in those rooms. We're going to do a full head-to-toe exam and make sure that everything looks physically normal. And we'll still screen you for postpartum depression because remember, postpartum depression symptoms can show up any time in that first year of life. At the 9-month visit, there's typically not any vaccines other than the flu vaccine and the COVID vaccine now. But there's the other routine vaccines of the primary series should be done at 2, 4, and 6 months. Now, the next checkup is going to be at 1 year of age, and we're going to go every 3 months now. So after 9 months, we do 12 months, 15 months, and 18 months. And we typically do vaccines at the next 3 visits. So the 12-month, 15-month, and 18-month visit, they will get some shots. It's typically between 5 and 7 vaccines, depending on whether your office does combo vaccines or single vaccines. And they will happen over the next few. We'll usually do 3 or 4 at a year, 2 or 3 at 15 months, and then 1 or 2 at 18 months. Remember that after a year of age, they're going to have their first dentist checkup and their first eye exam by an ophthalmologist if anyone in the family wears glasses. So you can get those scheduled now if you want to plan ahead, but also you can wait until next visit, and I'll tell you that again at the next episode, which will be our 12-month visit. So that's all for today. Enjoy your 9-month-old baby, and feel free to reach out to me on social media. My handle is Doctor at Your Door. I'm on TikTok, Instagram, Facebook, and I would love to hear from you if you have any feedback for me. Thank you for listening to the Baby Manual podcast. Please hit that subscribe button below so you don't miss the new episodes when they come out. I would also love it if you could leave me a review. If you'd like to buy a copy of the Baby Manual, it's on Amazon and Kindle. I'm the author, Dr. Carole Keim, and that's spelled Keim. You can also follow me on YouTube, TikTok, Instagram, or Facebook to get some quick baby tips that will make you feel like an expert. Thanks for listening.